Hi everyone, Lucie Shanahan, the Executive Director for the Public Health Unit with Albury Wodonga Health. Just thought we'd pop on here and give you a quick update as to what's happening across our region and some particular information for the Rutherglen community, as we know that we've reported a number of cases in recent days in relation to an exposure or an outbreak occurring at Rutherglen. Today we're reporting 15 new cases across the 5 LGAs that we support through our Public Health Unit. Of this, 8 are within the Wodonga LGA, 4 in the Indigo LGA and 3 within the Wangaratta LGA. We can see that again the majority of the cases are sitting in people aged between 0 and 30 years of age, and we know that the vast majority of cases are household contacts of positive cases, so people who have been living with or isolating at home with someone who is COVID positive, and unfortunately, but as we often see, through household contact, another person has acquired COVID-19. We're pretty confident that what we don't have happening across the region is lots of sporadic unlinked cases. We're able to link the vast majority of cases that we are advised of within 24 hours of being notified of these cases. In relation to Rutherglen in particular, we are aware that there is quite understandably a lot of anxiety across the community at the moment. When you see a number of cases pop up in your local town or close to your home, it is anxiety provoking, and we are aware that for the community they're feeling a bit uncertain and a bit unsure about what's happening at the moment. So we thought it'd be a good idea for just to jump onto here and tell you what we know. So what we know in terms of the current cases that are within Rutherglen. We know that all of the cases that are in Rutherglen at the moment are isolating at home. So when I say at home, I'm sure the local community are well aware that we're working with some larger accommodation venues that are serving as people's homes and have been people's homes for some time. These people are being supported to isolate at home and to quarantine, and there is a lot of support and effort going into enabling these people to keep themselves safe and work through the recovery period of their illness over the next 10 days or so that we have remaining of their isolation period. One of the key things and one of the key questions or things that I've been asked a lot in the last 24 hours or so is, when someone is isolating, are they allowed to be outside? And the answer to that is yes. So when someone is isolating at home, that person is able to move around their house and move around their own backyard and their own premises, and it doesn't matter whether that is one of the large-scale accommodation options that we're seeing at the moment or whether it is someone's private home. So that's why people may, I know, have been concerned by seeing some people out and about in the grounds or the yards of the venues that we know of in Rutherglen, but this is perfectly permissible. We are asking people though to remain at home, and so that is to remain within the grounds and within the buildings of the settings that we know where people are isolating. I must give a shout out to Indigo Shire, as well as to the local police, Department of Families, Fairness and Housing, Department of Jobs, Precincts and Regions, who are all working with us at the local Albury Wodonga Public Health Unit to coordinate a response and make sure that there is enough relief and support going in to support these people to remain in isolation for the next couple of weeks. This means things such as food, medication support and supplies, linen support and supplies, as well as access to things like internet, all those sorts of bits and pieces that enable people to stay at home and to be able to work through the isolation period for the next couple of weeks. So a huge thanks to the various people who are pulling together to put in a response and make sure that we can keep everyone as safe as we possibly can across town. This is also, though, a good time to remind you to come forward for testing and also to come forward for vaccination. So one of the other questions that we're being asked a bit at the moment is, why aren't we seeing any Tier 1 exposure sites listed for Rutherglen? And the key reason for that is because there are no public sites of concern. The sites where we know people have been or people are at are not considered to be public exposure risks. If we thought that one of the sites was a place where the general public had been moving through, where there was risk of transmission across the general public, we would absolutely be listing that site on the Victorian Government Coronavirus website. So whilst we do have sites that we are managing, none of these are of general public concern, and that's why we haven't got them listed on the public website. What we are asking though is for people to come forward for testing. So if you have the slightest of symptoms, just as we're asking anyone in any of the areas that we support, if you have the slightest hint of a symptom, we ask you to come forward for testing. We are confident that we are getting on top, and we're very close to being on top of our current local outbreak, but high testing rates is one of the best ways that we can make sure that we've been able to identify any hint of COVID across the community at all. So if you've got the slightest of symptoms, please do come forward for testing. Equally, if you've had your first dose of a COVID vaccine and you're now eligible for your second dose, please come forward for your second dose vaccine. We know that the vaccinations work, and we know that vaccination is one of the best steps that you can take to make sure that if you do acquire COVID, you experience a mild illness as opposed to an illness that may require you to be admitted to hospital. If it's been more than 6 months since you had your second dose vaccine and you're over 18 years of age, you're eligible for a booster dose. And we can provide booster doses through the vaccination hub in High Street in Wodonga. So please do come forward for your booster dose vaccine if you're currently eligible. So maintaining a level of immunity against the virus is again the best step that you can take to keep yourself safe at this time. If there are any other significant changes or any other key elements that we need to alert the community to in relation to any of the COVID cases that we're seeing across our region at the moment, we'll jump on here as quickly as we can. Thanks for tuning in, everyone. We do ask you to remain vigilant, continue to practice your good COVID safe behaviours, and we'll see you again soon.